A heart attack can strike at any moment, even when you think you're completely healthy. Don't be subjective. Watch this video until the end to learn how to recognize the early warning signs and how to save yourself or a loved one before it's too late. Heart attacks strike without warning. A fleeting chest pain, a slight shortness of breath that seems harmless, yet within minutes, it can claim a life. This is a serious public health concern in the United States, where cardiovascular disease has remained the leading cause of death for decades. According to the Centers for Disease Control and Prevention (CDC), every 40 seconds, an American suffers a heart attack. Each year, more than 800,000 people in the U.S. experience this life-threatening event. And alarmingly, about 1 in 5 cases occur suddenly without any prior warning signs. This makes heart attacks one of the leading causes of death, surpassing many other serious medical conditions. Heart attacks don't just affect the elderly. They are rapidly increasing among young people due to sedentary lifestyles, unhealthy diets, chronic stress, and underlying conditions such as obesity, high blood pressure, and diabetes. The frightening reality is that many individuals fail to recognize the warning signs, leading to delayed emergency response and irreversible consequences. So how dangerous is a heart attack? How can you identify early symptoms and protect your heart health? Let's find out in this video. What is myocardial infarction? After understanding the severe dangers of a heart attack, it's essential to grasp what this condition truly is. A heart attack occurs when the coronary arteries, the main blood vessels supplying oxygen and nutrients to the heart, become blocked, preventing normal blood flow. This obstruction significantly reduces oxygen supply to the heart muscle, causing damage to heart cells or even cell death if the lack of blood flow persists. When part of the heart muscle stops functioning, it weakens the heart's ability to pump blood effectively, potentially leading to heart failure or life-threatening arrhythmias. Without timely medical intervention, the risk of death is extremely high, especially within the first few hours of the attack. Causes and risk factors. A heart attack does not occur randomly. It often develops silently over many years due to underlying causes. One of the most common causes is atherosclerosis, a condition in which plaques made of cholesterol and fats accumulate along the artery walls, gradually narrowing the blood vessels. When these plaques become damaged, the body responds by forming a blood clot, which, if large enough to completely block the artery, can cut off blood flow to the heart, triggering a heart attack. Beyond this primary cause, several risk factors significantly increase the likelihood of developing heart disease. One of the most critical is an unhealthy lifestyle, particularly a diet high in fats, processed foods, and low in fiber. These dietary habits contribute to elevated levels of bad cholesterol in the blood, accelerating the progression of atherosclerosis. Additionally, excessive alcohol consumption can also be a serious risk factor, as it can damage blood vessels, raise blood pressure, and increase the likelihood of blood clot formation. Beyond lifestyle factors, underlying medical conditions also play a crucial role in heart health. Individuals with high blood pressure are more prone to arterial damage, creating favorable conditions for plaque buildup and increasing the risk of blockages. Similarly, diabetes raises blood sugar levels, which can cause inflammation and weaken blood vessels over time. High cholesterol levels, particularly excessive amounts of LDL bad cholesterol, accelerate artery narrowing, significantly heightening the risk of a heart attack. Apart from physical factors, chronic stress can also contribute to heart attacks. When under stress, the body releases hormones that raise blood pressure and heart rate, potentially leading to artery constriction and blood clot formation. Additionally, the risk of heart disease increases with age, especially after 50, as blood vessels gradually lose their elasticity. Lastly, genetics play a significant role. If you have a family history of heart disease, your risk is substantially higher compared to those without genetic predisposition. Symptoms of myocardial infarction. So, what are the symptoms of a heart attack? A heart attack doesn't always strike suddenly. It often has warning signs beforehand. Recognizing these symptoms early can help ensure the patient receives timely medical attention, reducing the risk of death and permanent heart damage. One of the most characteristic signs is severe chest pain, a sudden pain that feels like being squeezed or compressed heavily in the chest. This pain may last for several minutes or longer and does not improve with rest. It often radiates down the left arm, neck, jaw, or back. This is the most important symptom, but not everyone experiences the pain clearly, especially women and the elderly, who may feel more subtle or atypical discomfort. In addition to chest pain, many people experiencing a heart attack also feel shortness of breath, nausea, and dizziness. Shortness of breath occurs when the heart is unable to pump enough blood to deliver oxygen to the body, causing the patient to feel breathless even without physical exertion. Nausea and dizziness might be mistaken for symptoms of digestive issues or low blood pressure, but when accompanied by chest pain, they could signal an impending heart attack. Another important symptom is cold sweats and unusual fatigue. When the heart is under stress, the body responds by activating the sympathetic nervous system, leading to excessive sweating even without physical activity. At the same time, the patient may feel inexplicably exhausted, even when performing simple tasks. In women, this prolonged fatigue might appear several days or even weeks before the actual heart attack occurs. Since the symptoms of a heart attack can vary from person to person, many cases are easily overlooked or mistaken for other health issues. Therefore, if any of the above signs appear, especially persistent chest pain, accompanied by shortness of breath, nausea, or cold sweats, it's crucial to call emergency services immediately to receive medical support. Prompt action can significantly increase the chances of survival and reduce the risk of severe heart damage. How to deal with a heart attack? A heart attack is a medical emergency where every second counts in determining the patient's survival. Proper handling can reduce heart damage and increase the chance of survival. When you suspect someone is experiencing a heart attack, the most crucial step is to call emergency services immediately. Waiting too long or attempting to treat the situation at home can worsen the condition, so calling an ambulance as soon as possible is the most important action to ensure timely medical treatment. While waiting for emergency help, it's important to keep the patient calm and guide them to sit or lie down in a comfortable position, avoiding strenuous activity to reduce stress on the heart. When the heart isn't getting enough oxygen, movement or stress can make the situation even more dangerous. Additionally, loosen the patient's clothing, especially around the neck and chest, to help them breathe more easily. If the patient is still conscious and has no history of allergies to medication, they can be given one aspirin tablet, 160-325 milligrams to chew. Aspirin helps to thin the blood, preventing the development of blood clots, which are the primary cause of artery blockage in heart attacks. However, if the patient has a history of aspirin allergy or is on blood thinners, caution is necessary, and medication should not be administered without a doctor's approval. Another important point is to avoid moving the patient unless absolutely necessary, such as if they are in a dangerous location, or if you cannot call emergency services. Attempting to transport the patient to the hospital by personal vehicle can cause shock or worsen their condition if there is no medical equipment available during the journey. A heart attack can strike suddenly, but if handled promptly, we can save the patient and minimize heart damage. Remember, quick and proper action in the first few minutes can make the difference between life and death. Prevention of myocardial infarction. A heart attack is one of the most dangerous health conditions, but it can be completely prevented by maintaining a healthy lifestyle. One of the most important factors is a proper diet, which helps manage cardiovascular-related indicators such as cholesterol, blood pressure, and blood sugar levels. Limiting foods high in saturated fats, particularly from fast food, fried foods, red meat, and animal fats, is crucial as these can raise bad cholesterol levels and contribute to atherosclerosis. Instead, focus on consuming green vegetables, fruits, fatty fish, nuts, and whole grains, as these foods are rich in fiber, vitamins, and omega-3 fatty acids, all of which help protect heart health. In addition to diet, regular exercise is an effective way to enhance heart function, improve blood circulation, and manage weight. Activities such as brisk walking, swimming, cycling, or yoga not only help reduce the risk of heart disease, but also reduce stress and improve mood. Just 30 minutes of physical activity per day can significantly improve heart health and greatly reduce the risk of a heart attack. Another important factor is managing stress and ensuring adequate sleep. Prolonged stress can trigger the production of hormones that increase blood pressure and heart rate, contributing to the development of cardiovascular diseases. Taking time for relaxing activities such as meditation, reading, or spending time with family can help alleviate pressure. Avoiding late nights is also crucial, as quality sleep helps the body recover and stabilizes the cardiovascular system. Additionally, to protect a healthy heart, quitting smoking and limiting alcohol consumption are essential steps. Smoking contains hundreds of harmful chemicals that can damage blood vessel walls, accelerate atherosclerosis, and increase the risk of blood clots. Excessive alcohol consumption, on the other hand, can lead to high blood pressure, arrhythmias, and weaken the heart muscle. Therefore, completely quitting smoking and drinking alcohol in moderation can significantly reduce the risk of heart disease. Finally, regular health checkups are crucial for detecting potential risks early. Monitoring blood pressure, conducting lipid tests, checking blood sugar levels, and evaluating cardiovascular health regularly will help identify issues early and allow for timely intervention. Individuals with high risk factors, such as a family history of heart disease, being overweight, or having underlying conditions, need to monitor their health more closely to effectively prevent heart attacks. After understanding the preventive measures, it's clear that heart attacks are a dangerous condition, but the risks can be significantly reduced by maintaining a healthy lifestyle and taking proactive steps. Heart attacks not only affect the elderly, but are increasingly prevalent among young people due to unhealthy lifestyle habits. Recognizing early signs such as chest pain, shortness of breath, and cold sweats can help the patient receive timely medical attention, increasing the chances of survival and reducing the risk of severe complications. Protecting heart health is not just an individual responsibility, but something that should be addressed within families and communities. Take proactive steps to adjust your diet, engage in regular physical activity, manage stress, and get regular health checkups to keep your heart healthy. More importantly, share this valuable information so that more people can understand and prevent this dangerous disease, because a small action today could save a life in the future. Always take proactive steps to care for your health, maintain healthy habits, and don't forget to share this information so that more people can learn how to prevent this dangerous disease. If you found this video helpful, please like, share, and subscribe to the channel so you don't miss out on important health information. Thank you for watching.